Hey, this is Dr. Bob with Carolina Bayou Pet Care. Thanks for joining us. I want to talk to you about a very important topic that's going on locally. As I give this presentation, it's mid-November 2020. We're about a week before Thanksgiving. And if you're not aware, there's been a really significant epidemic going on in dogs in this region, from Greensboro, Charlotte, the whole Piedmont area. Involving dogs with upper respiratory infections. Now, this has actually started sometime probably early autumn, but has actually continued to pick up some momentum. We're hearing from other veterinary clinics that they're seeing dog after dog after dog that's coming in for coughing. Unfortunately, some of these dogs are not surviving the infection. It's that significant or that severe. So just take that in consideration. So how are these dogs getting the disease in the first place? These are primarily social dogs. These are the dogs that are party with other dogs. They're going to dog parks and they're going to the grooming facilities. They're going to doggy daycare. They are going to festivals with their owners where there's other dogs. They're going for like walks in the neighborhood. So you kind of get the picture. These are dogs that are coming into contact with other dogs. Doesn't mean they're around dogs all the time, but all it takes is just brief or relatively brief exposure, but more intense exposure will, of course, increase the likelihood of exposure to the conditions. Again, think of this being similar to COVID. Just because a dog's exposed to these different viruses or another dog doesn't mean they're going to get the disease. So it's unfortunate for those dogs who do get the disease. Can be treatable, but in some cases, again, in extreme situations, that actually has been proven to be fatal. So a couple of considerations. So there's three primary organisms, two are viruses, one bacteria that are primarily responsible for what's going on. The viruses are, one is a canine influenza virus, the other is a para-influenza virus, and the third is a bacteria called Bordetella. Now, perhaps if you've been getting vaccines on a regular basis for your dogs, you might be familiar with all three of these names. Obviously, the Bordetella, that's one we've been giving by mouth for years and years and years. Now, good news for you guys, if your dog are going to be going into these sort of social situations, we do now have a brand new, just came out last week in early November 2022, a brand new version of the Bordetella that is actually combines Bordetella and para-influenza in the one vaccine. So we've already removed the Bordetella vaccine and introduced the Bordetella with the para-influenza into our core protocols for your dog's vaccinations. So your dogs are actually getting an enhanced and a better form of protection against this form of a respiratory disease. The other type of virus that we're seeing again is a canine influenza virus. Now, this has been around for about 20 years in its initial version. Then there was a sort of a variation of the canine flu that came out about 10 years ago. Now, we have a vaccine that does protect against both variations or variants of the canine flu. We are running into a little bit of a problem, unfortunately, because we are having limited supply of the canine flu. We do see most of the dogs that do have the very severe issues and upper respiratory infections from the disease that can develop into pneumonia. Most of those dogs are actually coming from the canine flu virus. We do have it on hand, but unfortunately, all veterinarians are limited in access to it. Unfortunately, there's just limited supply out there. One of the manufacturers can no longer make it currently. The other one has actually just been overwhelmed by the response in trying to get enough out there for the veterinarians. And this is, again, all over the country. This is not just unique to this area. Yes, we do have it, and yes, we absolutely recommend it for your dog if they're going to be going into boarding facilities, doggy daycares, and so forth. I think you get the picture of those dogs that they're going to be most susceptible to the disease. One very important point about the canine flu vaccine, it's a two-shot series. The two vaccines, once the first vaccine is given, the sort of sweet spot for the booster is going to be 3 to 4 weeks. although we can go 2 to 6 weeks to get the booster. However, if you do not come back for the booster and you wait more than 6 weeks, we have to start over. Okay, that's just the way the body's reaction or response to the immunity works. So absolutely, if you've gotten that first vaccine for the flu, absolutely come back and get that booster. That's the only way we can ensure your dog's going to be protected against the virus. Once the once the vaccines are given for the flu, for the Bordetella, for the parainfluenza, usually it's about 5 to 7 days after the vaccines are given. In the case of the flu, about 5 to 7 days after the booster, the second vaccine is given, before your dog's going to be well protected against the diseases. So it is a significant issue. How long is it going to last? Nobody knows. Again, just like, think about this being sort of, I hate to call it a dog version of COVID, but I think that'll give you a little bit of a sense of the picture of how this is shaping up. Relatively new to this area, but unfortunately, it could go on for weeks, months. We don't know. Now, for the Bordetella parainfluenza combination, again, the brand new liquid oral medication or vaccine that we have, the recommendation is to give it every 6 months until we get through sort of the current crisis. So keep that in mind, and we will be sending out reminders for those dogs to get the booster in 6 months. But again, particularly if those dogs are going to be into these social situations. So a lot of you have been asking questions about it, and of course a lot of you are not even aware of this being the case. But again, just take that in consideration. We've actually got some additional information for you if you'd like to do a deeper dive into this sort of the whole situation with the vaccines and the upper respiratory infections. So anyway, hopefully that's a snapshot, get you aware of it. Know we're doing what we can on our end to protect your dogs. And if you have any questions, please reach out to us, and we hope to see you soon. Thanks for your time.